Here's a truth we can't ignore. The roots of severe mental illness are tangled in a web of biology, environment, and even the body's immune response. But here's where it gets controversial. How much blame do we place on genetics versus lifestyle choices or even modern environmental toxins? Let's unravel this complex puzzle together. And this is the part most people miss. The same inflammation that fights infections might also be fueling psychiatric crises. Ready to rethink what causes these conditions? Let's dive in. Severe mental illnesses, conditions like schizophrenia, bipolar disorder, PTSD, and autism are rarely caused by a single factor. Instead, they emerge from a dynamic clash between inherited traits and external influences. Recent studies show that these disorders are shaped by a mix of genetic predispositions, environmental stresses, and even the body's immune system gone awry. For example, someone with a genetic risk for schizophrenia might never develop the condition without triggering events like childhood trauma, drug use, or a viral infection. But how do we separate cause from coincidence? And what if the answer lies in the brain's response to inflammation? The genetic blueprint, more than just a roll of the dice. Genes play a starring role in mental health, but their influence isn't absolute. Schizophrenia, for instance, has a heritability rate of up to 80%, meaning most cases have a genetic component. However, no single gene is to blame. Instead, it's a combination of many small genetic variations affecting brain networks and cognitive functions. Mood disorders like bipolar disorder share genetic links with schizophrenia, while anxiety and OCD overlap with both. Autism, with heritability estimates of 70 to 90%, is equally complex, with genetic mutations impacting everything from social skills to neurological development. Yet here's the twist. Even with strong genetic risks, environmental triggers often determine whether symptoms manifest. Could this mean that prevention strategies targeting modifiable factors could reduce the burden of these disorders? Or is genetic destiny unavoidable? Share your thoughts below. Environmental triggers, the hidden players. While genes set the stage, environmental factors pull the curtain. Consider these key contributors. 1. Family communication styles. Chaotic or emotionally distant family dynamics can increase the risk of schizophrenia and other disorders. Think of it as a toxic soup of miscommunication that hinders emotional development. 2. Childhood neglect or abuse. Whether physical or emotional, early maltreatment rewires the brain's stress response, raising the likelihood of depression, anxiety, or PTSD later in life. 3. Lead exposure. Even low levels of lead in childhood can disrupt brain development, linking to attention deficits and mood disorders. But here's a debate. Should public health policies prioritize stricter regulations on aging infrastructure? Or is individual testing enough? 4. Brain injuries. Traumatic brain injuries, TBIs, don't just cause memory loss. They spark inflammation that interacts with genetic risks, potentially triggering psychosis or worsening existing conditions. 5. Postinfectious inflammation. After a severe infection, the immune system's cytokine storm, a flood of inflammatory proteins, can cross the blood-brain barrier, disrupting neurotransmitters and even causing autoimmune attacks on the nervous system. This explains why some people develop psychiatric symptoms after infections like Lyme disease or viral illnesses. Could this be the missing link in understanding sudden onset mental illness? 6. Substance use. From caffeine to cannabis, substances alter brain chemistry and amplify genetic vulnerabilities. But should we label recreational drug use as a risk factor or a symptom of underlying distress? The conversation needs nuance. Inflammation, the unseen culprit. Let's zoom in on post-infectious inflammation, a concept gaining traction in psychiatry. When the immune system overreacts to an infection, it releases cytokines like IL-6 and TNF-alpha, which don't just attack pathogens, they inflame brain tissue. This inflammation damages synapses, throws neurotransmitters off balance, and in extreme cases, triggers autoimmune responses against neurons. The result: depression, psychosis, or even OCD symptoms emerging after a seemingly unrelated illness. Imagine a scenario where treating inflammation becomes as critical as medication for mental health. Is this the future of psychiatry, or are we oversimplifying a complex problem? Putting it all together, a call for holistic solutions. Severe mental illness isn't a single story. It's a convergence of biology and environment. To prevent and treat these conditions, we need to address genetic risks, reduce exposure to toxins, mitigate inflammation, and support healthy family dynamics. But here's the elephant in the room. How do we balance personal responsibility with systemic change? Should individuals bear the cost of mental health interventions? Or is it time for public health policies to take the lead? And what about the role of pharmaceutical companies in developing anti-inflammatory treatments for mental disorders? The answers aren't easy, but the questions are urgent. What's your take? Drop a comment and let's debate, because progress starts with challenging assumptions.